slate at the Stardust, Tuesday, April 14th. Dr. Bingham.
Being here and honoring me by your presence here
Give
tonight.
it just one more minute, Bob. We got a couple
All
of
right.
straps.
Sure, let them come in. That's all right.
Mind if I sit here?
Sure, I think that's fine. You know, if people only knew how little doctors know, they probably wouldn't even go to them. One of my patients asked me the other day, Dr. Bingham, when did you have your last physical examination? I said, I think when I was flying a plane about 15 years ago. They said, well, why haven't you been in for a checkup since then? Well, I said, I don't know any good doctors. But that isn't quite true. Because I rely and have relied on the natural things that God gives people: exercise, fresh air, water, vitamins, good food, clean living. And so I think when you're healthy, you can stay away from the doctors. But if something's wrong with you, why, then of course I think you should go. And I don't like to talk much about myself, but I thought tonight I really should tell you a little about myself so you would know what the source of my knowledge and information is. My father was a doctor and graduated in the School of Medicine in the University of Colorado in 1904. And he wanted to be a medical missionary. So he also graduated from the Theological Seminary, the Southern Baptist down in Louisville, Kentucky. And then he graduated from medical school. And he married the girl who was my mother and took her down to his first missionary journey down in Guatemala. And they had a little boy. The little boy died down there, and Dad didn't know what to do for the little boy to save him at age 1 year. So they came back to the United States, had a couple more children, beginning with me in Colorado. And I decided to be a doctor when I was age 6. And it was a very easy decision to make because in that small Colorado town, my father had 2 vehicles: an automobile, which he drove in town on nice days, nice weather, and it was the first automobile in that county, Boulder County, Colorado. And then he had a horse and buggy, which he used on rainy days to go out in the country where there were not any roads for an automobile. And I wanted to be a doctor because he let me drive the horses and hold the reins, and I thought that'd be wonderful, going out on the house calls. I'd sit out in the car or in the buggy till he came back, and I said, it must be wonderful to be a doctor. And in some ways, he passed that love of medicine on to me. Matter of fact, he delivered me when I was born. He baptized me when I was about 11 years of age. When we got married, why, he married my wife and I myself. And then when I graduated from the same medical school, another 34 years later, he was there at my graduation. So I couldn't help but being raised in the medical profession. But one thing I learned from my father, because I followed his tracks around in Mexico and Nicaragua and United States where he practiced, that he was learning as much from his patients as he did his medical books. And after being in general practice, he wanted to be a surgeon in these cities and counties that he went to as a medical missionary. So he went to the Mayo Clinic. And 75 years ago, he finished his course at the Mayo Clinic when the Mayo brothers, William and Charles Mayo, said, well, now, Dr. Bingham, we've taught you every operation there is. You know all that anyone needs to know about surgery. You're a surgeon now. You can go out and practice surgery. So wherever he went, he could do everything from cataracts to toenails, and did so in these foreign countries. But every once in a while, he would run onto a disease that wasn't in the books that he hadn't seen before. And I remember very dramatically, a woman came in with a carbuncle on her neck, a great big boil-like thing. And we didn't have antibiotics in those days, and it was draining. And he looked in the books, and they said it's very often fatal. So he talked with a couple of farmers, and they said, well, this farmer said, I'll tell you what I do. If a cow gets one of those, I just take some of her milk and I heat it up, put it in a syringe and inject it to her, and she gets well. So My dad took some milk, boiled it, gave this person some injections of milk in the hip, and the carbuncle disappeared. So I learned that you did not need to get all of your medical knowledge from books. But I went ahead and got the best medical training that anybody I think could get in the United States in those years. Graduated the University of Colorado, went to the University of Pennsylvania in Philadelphia, 2 years, and tried all the different specialties of the internship. Went to Columbia Presbyterian Medical Center, New York City, took what I thought was the finest training in orthopedic surgery in the United States. Then the Army grabbed me for 4 years and took me out into the wilds of Mississippi, believe it or not, where I was a camp doctor, taking care of as many 300 orthopedic patients, doing operations 4 or 5 a day, and then to the South Pacific, where we started in at New Caledonia and went right on through the islands up, finishing up in Philippines and the occupation of Japan. And then I wanted to do private practice. Well, in medical school, I was most interested in crippled children. And so I learned to do all the operations that they could do on children, particularly those in correcting deformities and poliomyelitis. And then we had some terrible epidemics of poliomyelitis in those years. And Sister Elizabeth Kenny came to this country from Australia. And I had in New York the opportunity to work with her and in our hospital take the braces and the casts off these children with polio and start putting them in hot packs and see how wonderfully they recovered without deformities. And also at the University of Pennsylvania and in New York, where we were treating arthritis patients, I learned all the arthritis operations they were doing in those days. But I was also interested in the medical treatment of arthritis, because they were saying then, as they do now, and mostly for fundraising now, that there's no known cause for arthritis, no known cure for it, and to please give us as much money as you can to the Arthritis Foundation for research. By the way, the Arthritis Foundation in all these years has never come up with anything in that research money that we use in the clinical practice of arthritis, rheumatology. And the reason is that the money that they raise goes mostly to PhDs in medical schools doing basic research, looking for the causes of arthritis in test tubes. They'll never find them. They find them in people. But when I started practice, we had some terrible epidemics of polio in California. And Sister Kenny came out to California at my request from Minneapolis. We helped set up the Sister Kenny Elizabeth Institute in El Monte. Rosalind Russell was on our board of directors. We treated a third of the patients in Los Angeles area that had polio with her treatment with very good success. But some of these children came from the desert, and they couldn't take the hot packs out here and use the wash tubs and put on the hot packs, take them off, cool them. It was a terrible job in this heat. So we decided we would try the hot mineral water. So we put these children in the hot mineral water. We found out that these polio patients bathed in this water 2 or 3 or 4 times a day. They got along just as well. And later I found out we're getting along better than the ones in the hospital who were getting hot packs, because besides getting the heat in the water to improve their motion, relieve their pain, and support their bodies while they exercised and improve the circulation, they weren't lying just in bed with the pack on. And the stimulation of moving their arms and moving their legs while they were in this warm water was healing their muscles and preventing stiffness in their joints just better than even the hot packs. And Sister Kenny, who spent her last 7 years working with us out here, certainly approved of this treatment. And then we started what in the Desert Hot Springs is called the Angel View Crippled Children's Foundation. This was back in the late 1950s. It's still up on the hill. We started out in a little rented room downtown. We saw patients free in the afternoon, crippled children patients, and adults for a charge in the morning. We supported it that way. And a man named Audrey Wardman here in Desert Hot Springs gave us 26 acres of vacant land up on the hill. And we raised money and he contributed money. We built a little outpatient clinic, and then we put it in a swimming pool, and then a hot therapeutic pool, and a place for 16 children to stay, and then 50 children to stay. and here it is still operating. Right now, it's mostly a home for cerebral palsy children, because you know the government with their Crippled Children's Services and their public health clinics have taken over pretty much the treatment of crippled children, so we don't have an open crippled children's clinic. But I became so interested in the children with arthritis. Now you would say, children with arthritis? Yes, the youngest patient I've had was 1.5 years old. A baby, the daughter of a motion picture director from Hollywood, and this little girl had never walked, never stood up, and couldn't stand up. They carried her around on a great big soft pillow, laid on the back seat of her car. At night, either her mother or father had to wake up her 2 hours and turn her from one side to another, because she couldn't turn herself. Her joints were so painful that even to hold up a cup to her hands to drink was painful in doing it. She'd been in the university hospital and the children's hospital, and said this child will be a total cripple and never walk again, never be able to stand. Well, we started out with our routine, which was natural foods, vitamins, and the hot mineral baths. She went in the hot mineral baths, believe it or not, 9 times a day. That little child started improving. In a month, she was able to stand. In 3 months, she was able to walk. And 6 months later, she's able to run from the automobile all the way down to my clinic and throw little arms around me. As we said goodbye, she went back home. Unfortunately, her father got onto rock cocaine like a lot of these people do in the motion picture and television industries. I mean, they get tempted into these things, and he got picked up and put in jail. Mother took the little girl, went back east. I've had a note from her too. She's been very well, but I didn't get to see her again. But she was just one of the many little children that we treated with arthritis, and they improved faster. We had a child from Las Vegas. We had some from Saskatchewan in Canada. We had some from Atlanta, Georgia. And the only difference, or differences I should say, between those treatment of those children when we received them, the treatment before, was that we gradually cut down on their drugs. We put them in hot mineral water from 6 to 9 times a day. We gave them just natural foods, nothing that was in cans or bottles or prepared, artificially sweetened. Kept them away from the things, some of the things they like, the candy and the sugar, the chocolate and so on. And gave them lots of milk, and then here we're able to get the certified and raw natural milk, which you only get in a few places in the United States, because it's a little more digestible and the calcium is a little more absorbable than ordinary pasteurized and homogenized milk. And these children recovered from arthritis. When I say recovered, if we got them early enough, they recovered without any deformities and made full recovery and use of their joints. The last patients we've had this last year came down from Saskatchewan, and a professor of pediatric rheumatology there has sent children down here for our treatment, and finally sent one of his young woman doctors down here to spend a month to see what we were doing so she could introduce this treatment into Canada. And these people came down in the wintertime. There wasn't much doing on the farm, so the husband, wife, little girl or boy with polio, with arthritis, and sometimes their brothers and sisters would come down with them and stay 2 or 3 weeks or a month while they're under treatment. Now, this was a good experience with children, and it seemed to me that if it worked just as well for crippled children, why wouldn't it work just as well for adults? And as I came down here weekend after weekend, on a Friday usually, and saw patients, stay down Saturday and Sunday and go back to my orthopedic surgical practice in Riverside County or Orange County, I ran onto some people in Desert Hot Springs that had gotten over their arthritis and completely well without ever seeing a doctor. They came down here because the doctor said, well, we don't know what to do for you anymore. There's nothing more we know how to do. You've tried all the treatments, all the medicines. Get out and try the desert climate. And of course, those doctors didn't know anything about the natural hot mineral water, just because how many doctors in the United States do? There's nothing in the medical books about spa therapy. There's nothing in the medical books about hot mineral water. And the last book that really covered this subject thoroughly was written by W.K. Kellogg of Kellogg Cornflakes fame in Battle Creek, Michigan, about 1896. And no one has ever written very much about using hot water and mineral and hot packs and that sort of thing since. But the patients came out here and lived out here, went in the hot mineral water baths, had the air and exercise. They got away from stress, they got away from pollens, they got away from noise, they got away from the style of living that they were doing, perhaps drinking and smoking. Out here there's not much to do in the evening. They go to bed early, they get up early, and they recovered from their arthritis completely. And then in our clinic, we had some very, very observant doctors. One of them was a dentist, and as he was putting braces on these children's teeth, he was correcting their diets. He was taking away all of the bad foods. And when we took away the bad foods from adults, they improved too. So 60% of our patients, their arthritis improved just by improving their diets. Cutting out the processed foods, cutting out the high fats, cutting out the sugars, the sweets, giving them lots of vegetables, lots of fruits, milk, eggs, 2 glasses of milk a day, 3 eggs or so a week, and they got better. Now, did we worry about cholesterol? No, because cholesterol in cream and milk is good for you because it carries the essential fatty acids that are good for your nerves and your skin and your hair. If you take just skim milk, or if you're using a little margarine instead of butter, you're missing some essential fatty acids. Why don't you worry about the cholesterol? Because you're exercising and burning up the fat that comes along with the milk or the butter. And you have to make it up in exercise when you add those fats back into your diet. The same way with eggs. Eggs are good for you. The cholesterol in eggs is not going to harm you or harm your blood vessels if you leave off and reduce your sweets and starches. Now what happens? You have white bread and sugar, for instance, and you have eggs. You go out and toast and jam, and what does your body do? It lives on that toast and jam and the sugar in your coffee, and you gets quick energy from that. And then the cholesterol in the egg is absorbed. But if you skip the white bread, and if you skip the sugar, and if you skip the coffee, then the body utilizes the cholesterol and the fat in that egg for energy that day, and you've burned up, and you've used up that egg, so it hasn't deposited any cholesterol in your joints. So no matter what a person's cholesterol levels are, as long as they have normal liver damage, normal liver with no liver damage, we say 3 to 5 eggs a week, 2 glasses of milk a day are good for you. How about fruit? Up in San Francisco, there's a wonderful old Chinese doctor, Dr. Dong, and I call him Ding Dong because he had for years the idea that people should have citrus along with their diets with arthritis. That orange juice, grapefruit juice, and so on made arthritis worse. And he said that, and he published it in a book, and it was very popular and sold lots of places. And he based this theory on patients in Japan and Korea and China, because there's very little arthritis over there compared with our country. And of course, a lot of them don't live as old enough as we do here. And he thought it was because they did not have those fresh fruits. And you can have a very difficult time getting orange juice or grapefruit juice, lemon juice, or lime juice in those Oriental countries. So he thought that was the reason. Well, eventually he decided he would test it out. And he gave the Arthritis Foundation around $100,000 to test his diet, and they found that he was absolutely wrong. He was disappointed, but on the other hand, he was glad that an error that he'd used in practice all of his life was corrected. And the reason the juice is good is that the acids in those juices are natural acids. They add to the stomach acid, they help absorb calcium, which protects and heals your joints and bones. It also is high in vitamin C. And vitamin C protects you against infection. All right, now let's get back to the natural mineral water. You've been here and you may be told about it. It isn't the type of mineral water you see in very many places in the world. The reason is it has the minerals coming from the earth. It's called pelagic water, and it comes from the branches of the San Andreas Fault up here, which is the famous earthquake fault. And the water flows down under this building and under all of Desert Hot Springs down to the dry Whitewater River. And from there it goes on down to help irrigate about 80 golf courses. And this water varies all the way from up at Sky Valley over 200 where they can't use it because it puts too much mineral in the plumbing, to about 90-degree water, which the city, for a while, it was the coolest water they could find to put in the city system, was 90 degrees. Because even the mineral water, the rainwater from the mountains and hills is mixed with hot mineral water, so by the time it gets in town, the best well is around 90 degrees. Now they're going way up by Mission Creek, and they're getting water that's a higher percentage of rainwater and snow runoff, and not as much mineral water as when they drill right here in town. But the amount of minerals in the water depends on the temperature of the water. One of the sorriest things about this town is that because of health department rules, you can't go and take your jugs like you used to and go almost anywhere in town and turn in a tap at a hotel or motel or resort and fill your jugs with mineral water and take it home or drink it in mineral water fountains, because the health department said all the water that's drinking water is going to be tested and sold. Now the city water, however, is so good that they can put it right from their wells right into the city system here with no chlorine, no purification, no filtration, or anything else. So number one, we've got excellent water here in town, drinking water, partly from the rain and snow melt in the mountains, and partly from the natural hot mineral water that's mixed with it. Now, the hot mineral water comes down and into the pools. The warmer the water, the more minerals there are in the pools, and that's why the hotels and motels like this one and some of the others that have the natural hot mineral water and don't have to take this water and heat it and bring it up to temperature, keep it up this way, have a higher mineral content in the water. Now, what do the minerals do? The minerals are the same ones that are beneficial to your body. The minerals are the same ones that are beneficial in arthritis. In France, they say it even goes through the skin. I've never proved that, and I don't know how I would. But in the French spas, the doctors all say, yes, the minerals go through your skin. We know that when you're in the water and up to your neck, you're breathing water vapor. That water vapor is heavy in minerals, so you get some of that way. And when you drink the city water, you get some mineral water. So you're getting mineral water through the skin, and you're drinking it. But mineral water helps to hold heat, and it has one of the things in it besides the minerals that are good for you. It has a certain amount of silica. If you notice when you get out of the mineral pools, instead of your fingers all wrinkled and the skin is dry, you have a sort of silky smooth feel in your skin. That's the silica in the water, and it doesn't take any of the minerals out of your body, but it helps put minerals in. Now, it isn't just the heat of the water. If you went into hot water and stayed out there for 20 or 30 minutes in a hot pool, you'd come out like a soft-boiled egg. That isn't good for you either. Sister Kenny proved, and so did W.K. Kellogg in Battle Creek Mission years ago, that the alternate heating and heating and cooling is the effect of the mineral water that does the most for you. And in old W.K. Kellogg's book, he shows a man standing in a shower, and the physical therapist has two hoses here, one with a valve on it of ice water and one with hot water. And he sprays this man with hot water as the fellow turns around, and then he sprays it, turns that off, and turns that cold water on him. Well, that's sort of a shock way of doing it. Yeah. But what he was doing was opening up that man's pores and bringing the blood to the skin and under the surface of the skin and opening up the blood vessels with the heat, and then turning the cold water on and shrinking all those blood vessels and forcing that blood back into the body. Now the bones and joints, the surfaces of the joints, for instance, have no circulation at all. They have to get their circulation, the cartilage has to come from absorption around the edges of the joints and from the synovial membrane. And when you heat that synovial membrane by getting in the hot water up to your neck, you're increasing the flow of blood into the joints and muscles many times. Actually, if I were to take a thermometer and test your feet in here, most of you would test around 70, 75 degrees. Well, when you're in that water at 102 to 105, you increase that temperature about 30 degrees. And this has increased about 3 times the amount of blood flow temporarily that's going into your muscles and bones and joints. Then when you go out and cool off again, And we say after you've been in the hot water for 5 or 10 minutes, you get out and cool off. You can cool off by getting out in the air, the wind, and I tell patients, go in the hot water even if it's raining or snowing, because you don't catch cold. Your body is like a radiator. It radiates heat after you come out of the hot pool. But stay out until you feel a little cold and chilly, then go back in a second time. This time you don't have to stay in so long to get warmed up. You maybe warm up in 5 minutes. Then get out of the pool and go over in the other pool and exercise and swim and move your joints around. And let the water support your body until you feel you're limbered up, until you're maybe tired. Or get out if it's a nice day and walk for a while till you're tired. Then go back in the hot pool a third time for maybe about 5 minutes. Get thoroughly warm and then go dry off, lie down and rest for a while. Now that is what we call the 3-dip method. You don't do that just once a day. If you are like my patients that come here from different parts of the country, they spend about 2 weeks here for treatment and then they go ahead and follow the routine at home with their family doctors. They do this 3 times a day, and each time they go in for 3 times. That's 9 dips in the hot pool a day. 9 times a day, you're heating your body off and then cooling it off, heating it up and cooling it off. And this is the thing that limbers up the joints. It takes the stiffness out, it improves the circulation, relieves pain, relieves stiffness, and it improves your digestion. And people worry about their hearts and blood pressure. Well, in the hot water, if you will take your own pulse, you'll find it goes a little faster. And that's just like an automobile going downhill. When a car is going downhill, you know, the engine speeds up a little, maybe makes a little more noise. So you may feel your pulse there, and you may feel a little pounding in your chest. You'll find it goes a little faster. And that's just like an automobile going downhill. When a car is going downhill, you know, the engine speeds up a little, maybe makes a little more noise. So you may feel your pulse there, and you may feel a little pounding in your chest because your heart is coasting, it's going downhill. The blood vessels have opened up, so the heart is going a little faster, but it's doing less work. So we've never had, Lord hear me, keep with me, we've never had a person die in a hot pool here in Desert Hot Springs, no matter what their heart cardiac condition is, because it improves their circulation and heart to go in the hot water. Now, that's one of the benefits. The other benefit is exercise. In the water, your joints and muscles are supported. If you can get your arms up this far in the air, when you get in the warm water and they're warmed up, you can get them much higher. The same way with your hips. After you've been in a while, or your back, you'll be able to bend down and touch your toes easier because you've warmed up the muscles and the circulation in your body. Now, let me talk a little bit about the types of arthritis that we see here. Number 1, arthritis is not hereditary. You didn't catch it from anybody. If your mother or grandmother or father or aunt or uncle had arthritis just like yours, it was probably because they were on the same kind of diets you were, lived in the same environment, the same kind of stresses, and were subjected to the same kind of germs. But it is not hereditary. Number 2, it isn't caused by old age. It can be caused by 70 or 80 years of eating the wrong foods, you know, and not getting the right exercise, or taking poisons from the air or from your food, or smoking or drinking into your body. Sure, that would cause arthritis, but it isn't caused by old age, because God gave you the kind of muscles and joints that should last you 100 years. And we have patients, and I have patients now that are over 100 years old that have no arthritis at all. They come into our clinics and our other doctors for other conditions, but they don't have any arthritis. One man up here in Banning is 94 years old. He keeps house by himself, does his own gardening, and drives 40 miles down to see me once a month. What has he got? He's got bunions, and we've been arguing whether to take them off or not. And I remember one little woman we operated at Loma Linda for bunions at 90, and she lived to be 94. She said, I wish, Dr. Bingham, that I would have had these bunions done when I was young, when I was about 70. All right. I did over 1,500 joint operations. I did the first hip replacement, total replacement operation in California. I've done about every hip joint operation, knee, shoulder, arms, elbows. I've done over 1,000 back operations. I've operated over 2,000 crippled children. And when the traffic and the congestion in the hospitals in Orange County and the malpractice went up to $80,000 a year, I said, here, I'm working more for the insurance company than are myself. I'm coming out to Desert Hot Springs and do what I enjoy doing, that is treating patients with arthritis. Now, what is our arthritis program, as we call it out here? I've told you part of it, which is the hot mineral water baths. I've told you another part, which is diet. There are 4 foods that make arthritis worse. They contain solanines, which are related to nicotine. They are in potatoes, tomatoes, eggplant, and peppers. And any grower or farmer that has those, he knows those poisonous things are in there. Those were never food plants 100 or 200 years ago, but they have been developed into food plants, but they have solanines in them, small quantities, and the growers are trying to get less and less because 50% of patients with arthritis have pain if they eat very much in the way of white potatoes or red potatoes, tomatoes, peppers, or eggplant. And if they have a big Italian dinner or Mexican dinner that had a lot of those foods in it, they might have to have someone to help them get out of the restaurant back to their car, like a couple of patients are hard to get out of bed the next morning. They wonder why all night long they were aching all over. They come down with the flu or something. No, it's the solanines in the food, which is somewhat related to nicotine. Since we have no tests to say who is sensitive to solanines and who is not, we say to all our arthritic patients, none of these foods. Now, if you go out and take a lettuce salad and has a couple tomatoes on it once a week, or you go out to dinner and they have a baked potato on the table once in a while, sure, it isn't going to hurt you. But don't buy them every day, don't eat them every day. If you have arthritis, stay away from them, just as a rule. All of the fresh fruits and vegetables are good for you. There are no other foods that are bad for arthritis. But all of the processed foods are. And the reason are white sugar, white flour, and the starchy and fatty and high-fat foods, and the foods that have a lot of Crisco or snowdrift in, cottonseed oil, canola, oil from the palm oil from the South Pacific. All of those tend to displace the natural oils in your body. And so you want to stay away from those, but have the natural foods. The next thing, we use vitamins as treatment. We give the patients a whole list of vitamins to take, 6 or 7, sometimes 8. And they take 2 a day of each one of those for 3 months, and 1 a day of all of them for 3 months. Because we find that 60% of our patients will improve when we improve their diets and give them these vitamin supplements. We give them around 2,000 milligrams of vitamin C a day. We give them B complex with vitamin C, a couple of those a day, which is the stress vitamins. We give them vitamin A and D a day. Vitamin A, 800 international units. We give them vitamin E, which is good for your heart and your circulation, which prevents strokes, which prevents hardening of the arteries, which prevents heart attacks. 800 international units a day of vitamin E. If they're anemic, we give them a little bit of iron along with B complex, folic acid, and vitamin B12. So these are the vitamins we use. And then if they have osteoporosis, which a lot of women have, we give them extra calcium in addition to 2 glasses of milk a day. Now, with osteoporosis, which many women have, we use Premarin, their female hormone. We're not afraid of it. They prove that Premarin does not cause cancer. If you have cancer, particularly cancer of the breast, it will grow a little faster when you're taking Premarin. They'll find it faster and they take it out. But they made a study and they find out that Premarin, a female hormone, does not cause cancer. And we don't try to reestablish a menstrual cycle. We give it 5 days a week, then off 2 days, and 5 days a week. So you have a smooth type of treatment. And this prevents the osteoporosis, prevents the fractures of the spine, prevents hip fractures of these elderly people, and it also hardens up on their bones. A sweet little old lady came to me after church one day and said, Dr. Bingham, look at my hands. The joints are getting a little larger here, and they're getting painful. All of them are painful. I said, listen, dear, you don't have to come to the office to see me. Just write these 3 things down and start taking them, and have your pharmacist call me, and I'll order the prescription for female hormone. I want you to take 2 vitamin A and D capsules every day, cod liver oil capsules every day. I want you to drink 2 glasses of milk every day, and then have your pharmacist call me, and we'll give you 1 Premarin tablet 5 days a week. In 3 weeks, she came up and said, looky here, no more pain, no more swelling. Look how I can move my hands. Well, I said, you stay on this 6 months. All you've done is made a start on it. You're not over the hill yet when it comes to osteoporosis. But I've probably prevented her from being like this when she's older. I probably prevented her from having a broken hip, compression fractures of the spine, wearing a brace on her back, having injections of calcitonin, and really a sad old age, which a lot of people have, because they say, well, milk doesn't agree with me, it causes mucus, or it causes gas, or somebody told me that older people didn't need milk. All of those good excuses for not drinking it. Now, if you can't drink regular milk, try yogurt, try buttermilk, try cottage cheese, try goat's milk, and try to get the freshest and best kind of milk you can. You'll be surprised how many people will be helped right away. That's osteoporosis. Osteoarthritis. Osteoarthritis can come from injuries or damage to joints that interferes with the circulation to joints. But most osteoarthritis comes from poor circulation to the joints. And this is where the hot mineral water baths come in, by improving the blood flow to the joints. And if you can keep your joints limbered by exercise, good diet, and your vitamins, and you get enough hot baths or warm weather or something to keep the circulation good, you probably won't get osteoarthritis. Now, if you're in an occupation where you stand all day, you may get it in your feet or knees, you know. If you're in an occupation, particularly if you're on a poor diet, or where you use your hands all the day, you may get it in your hands. But it's poor circulation in those joints that causes it. Rheumatoid arthritis. This is the one that children have, some that adults have, that is terribly, terribly crippling. Right now, the regular rheumatologists, I'm an orthopedic surgeon, board certified. The regular rheumatologists give you what they call non-steroidal anti-inflammatory drug. And I'm revising my book now, and it's sold about 7,000 copies, and it's out of print, and I'm doing a revision on it. And for this revision, I had to put in an insert, a list of what we call the non-inflammatory, non-steroidal anti-inflammatory drugs. And these are the ones that the doctors give you for arthritis. Bayer, aspirin, ascriptin, bufferin, zorprin, ecotrin, aspirin, Alka-Seltzer, USP, anacin, fluorono, talwin, meclamin, trisolate, Motrin, Rufin, Advil, Rufin, Nuprin, Mediprin, Alpha, Arudis, Naproxen, Anaprox, Rolofin, Indocin, Clenarol, Selectin, Butazolidine, Feldine, Voltaren, Orudis, and Ludine. All right.
Wow.
Let me tell you, ladies and gentlemen, you can take those for a year or 10 years, and at the end of that time, your arthritis will not be one bit better. None of those drugs change the course of arthritis. They make you more comfortable. They call them anti-inflammatories. You feel more comfortable when taking them. You have a little less pain, a little less swelling, a little less stiffness. If you stop them, it's right back again. At the end of the year, the disease is a little worse than it was before, but it does nothing for arthritis. Then, I've done something this last year that I've never done before, and it hasn't been published yet, and I'm giving you folks tonight an opportunity to see what we've done in our research this last year. We have compared these drugs and aspirin with the benefits of the hot mineral water, and we've scored them all on the basis of relief of pain, relief of stiffness, duration of action, reduction in joint swelling, reduction in inflammation, improvement in circulation, length of treatment, complications, and permanent improvement. And I'm going to pass these out to all of you. And hot mineral water comes out number 4 in all of them. Aspirin comes out in 2s and 3s. The non-steroidal anti-inflammatories comes out in 2 or 3s. But the hot mineral water at the end of the year is the only one of all of those that causes any improvement, permanent improvement in your disease. So this is a research study we've just finished, and they're very interesting comparison. Now, rheumatoid arthritis, in 1977, we first got the clue as what the cause was when a doctor in England, Dr. Roger Wyvern Mason, was looking for a cure for cancer, and he found some interesting little organisms in these cancer patients, but they also had arthritis. He found out those weren't cancer organisms, they were arthritis organisms. They were amoeba, two kinds of amoeba. And he used a drug called clotrimazole that he got from Germany, a research drug, and 9 out of 10 of his rheumatoid patients got well. Clotrimazole is made by Bayer in Germany. I flew over there to see him, talk with him, and then I went over to Leverkusen in Cologne, Germany, and went to the factory where they made this. I talked to the doctors there and the scientists. They were enthusiastic. And I came back to the United States, to New Jersey, to Sharing, and we arranged research in this drug. Then I got permission from the Food and Drug Administration to do research on it. And then Bayer company that makes Bayer aspirin would not release it. They made an administrative decision of their board of directors that they would not release this drug for the treatment of arthritis, and they would not support any research into the cure for arthritis. And today, you can't buy that drug, take by mouth, in the United States. I was so sold on this that I found out in England that they were putting it in vaginal suppositories. So I had my patients import vaginal suppositories, 1,500 of them per patient, $1,500 per patient. They swallowed 15 vaginal suppositories a day, and 7 out of those 10 patients got over their active rheumatoid arthritis. Nowadays, I have a sort of secret source of this drug. I get it from another country where it's imported for another person, another disease, not for human use, and we get it and bring it to this country and use it when we need to. But meanwhile, we've been developing other drugs. We have Flagyl, we have tetracycline, we have sulfasalazine, we have iodoxin. We have about 5 drugs now we can use for rheumatoid arthritis, and it kills the germs that live in a person's body and put out these poisons that destroys the germ in the patient's body all their lives. Finally, patients in the Washington, D.C. area who were under Dr. Thomas McPherson Brown were so enthusiastic about their results of taking tetracycline that they went to the federal government and got the government to put out $2 million for a study that started last September, run 2 years in antibiotics for rheumatoid disease. When that study is out, I think doctors all over the country will be using it. Meanwhile, there are about 30 of us that are specialists that are using them, about 300 other doctors are using them. We have our own little organization, our own little medical magazine, and I brought some of them here for you to take home with you tonight, along with some old copies of a newsletter that I used to publish. Some of this for you to take home, and you can read or pass them on to any relative or friend that has arthritis, rheumatoid disease, even your doctor. And maybe 1 or 2 years from now, when it comes out in the American Medical Association Journal, that this treatment is approved, they'll all be using it. I hope so. I hope you've enjoyed my talk, and I'll answer any questions with the best of my ability. But you're a wonderful audience, and all stayed awake and alert, which is amazing.
Dr. Bingham.